Good day, class and Miss Guerra. So, our group is presenting on methamphetamine, and our group members are Oswald Gillette, Kylie Alamilla, Velveth Molina, and myself, Irteza Alif. So, we start off with what exactly is methamphetamine. So, methamphetamine is a very, very powerful and highly addictive stimulant drug that affects the central nervous system. That's the general idea of what methamphetamine is. However, it has different names. Methamphetamine is actually derived from N-methylamphetamine, and its organic name is N-dimethylphenylethylamine. People won't remember all those hard names, so some trade names that are used are desoxin, methadone, and Syndrox. Those names are also hard, and so meth has street names. These street names are speed, meth, crystal, crystal meth, glass, shards, ice, tick, crank, twick, redneck cocaine, and in New Zealand it's called P.
Now that you know what methamphetamine is, let's learn about where it came from. Amphetamine was first made in 1887 in Germany, and methamphetamine, a more potent and easy to make version, was developed in Japan in the year 1919. Methamphetamine went into wide use during World War II, when both sides, the Allies and the Axis, used it to keep their troops awake. After the war, methamphetamine abuse by injection reached epidemic proportions when supplies stored for military use became available to the Japanese public. In the 1950s, methamphetamine was prescribed as a diet aid and to fight depression. Easily available, it was used as a non-medical stimulant by college students, truck drivers, and athletes, and abuse of the drug spread. Then, in 1970, the US government made it illegal for most uses. After that, American motorcycle gangs controlled most of the production and distribution of the drug. In the 1990s, Mexican drug trafficking organization set up large laboratories in California. While these massive labs are able to generate up to 50 pounds of the substance in a single weekend, smaller, private labs have sprung up in kitchens and apartments, earning the drug one of its name, stovetop. How is methamphetamine classified? Methamphetamine has been classified by the US Drug Enforcement Administration as a Schedule II stimulant. This makes it legally available only through a non-refillable prescription. Medically, it may be used for the treatment of attention deficit hyperactive disorder, or ADHD, as a short-term component of weight loss treatments, but these uses are limited and it is rarely prescribed. Also, the prescribed doses are far lower than those typically misused. The active ingredients. The methamphetamine drug is highly pure, potent, and low in price. The drug can be easily made in small clandestine laboratories with relatively inexpensive over-the-counter ingredients. These include pseudoephedrine, a common ingredient in cold medication, ephedrine, a decongestant that improves breathing by clearing the nasal passages, and hydrous ammonia, a colorless gas often used as a fertilizer and refrigerant, sodium hydroxide, it is used to dissolve roadkill, it is corrosive and can also burn the skin or cause blindness, red phosphorus, a highly flammable substance used on matchboxes, in fireworks, and in other explosives, sulfuric acid, which is found in drain cleaner or toilet cleaners, it is corrosive and can cause severe abdominal pain, tissue damage, and bloody vomiting. Battery acid can cause severe burns and speech problems when swallowed. Freon, a refrigerant that can cut off oxygen to the cells and lungs. Acetone, an extremely flammable ingredient that is found in nail polish removers. Iodine crystals can cause coughing, wheezing, diarrhea, abdominal pains, and redness of the skin and eyes. Lithium, this is a soft metal that reacts violently with water. The metal can burn all body tissues and cause stomach pain, seizures, and coma. Hydrochloric acid It is so corrosive that it can remove rust from steel and is capable of eating away flesh. Toluene is found in brake fluid and it is so corrosive that it can dissolve rubber.
Relationship of methamphetamine to someone's health. People often abuse meth for its euphoric properties. It increases the levels of dopamine in the brain, causing individuals to feel and enhance their sense of well being. It also increases serotonin and norepinephrine, so someone who uses meth causes a soup of neurotransmitters to be released in the brain. Because methamphetamine causes large doses of dopamine to flood the reward circuit pathway of the brain, it essentially teaches the person's brain to repeat taking the drug as a mean of recreating this pleasurable effect. Taking meth, especially in large portions, could lead to brain damage, cognitive problems, mental health problems, some of which could be permanent. The brain damage that meth can cause resembles certain dementias like Alzheimer's disease, and research has also suggested that people who abuse meth are at higher risk of Parkinson's disease. Adding to that, chronic meth use also may cause psychotic episodes that resemble schizophrenia, which makes sense because excessive dopamine in the brain leads to schizophrenia in a person. Body evidence indicates that chronic use of methamphetamine can result in this brain damage via neural death as well. It affects hippocampus, the sternum parietal cortex, frontal and prefrontal cortex, and the cerebellum. The excessive use of meth also leads to decreased levels of dopamine and serotonin because the neurons then have less of these neurotransmitters to use later. This then leads to extreme mood effects such as initial extreme euphoria followed by extreme periods of depression, apathy, and hopelessness. Meth also increases glutamate and calcium in the brain, which are often associated with neurotoxic effects, as a result of neurons being overly excited and continuing to fire to the point of damaging the system. This all makes sense because calcium is the key to the release of the neurotransmitters into the synapse and then to the receptors. These neurotoxic effects lead to significant damage in the dendrites of neurons, therefore preventing neurons from communicating effectively, which then affect cognitive and motor functions. Additionally, the use of this drug also affects the veins, arteries, and capillaries in the central nervous system due to issues associated with blood pressure, weakening veins and arteries, leaving them open to clots and scarring them, resulting in increased possibility for stroke. Lastly, the euphoria that meth causes fades relatively quickly. Therefore, to maintain a constant high, some individuals repeatedly take the drug in large doses every few hours for several days, called binge and crash. And during this time, they usually give up food and sleep, which directly affect their health later on.
Next, we move on to typical users and abusers. So, people who use methamphetamine like it, they really like it, and that's because it gives them an energy and makes them feel confident, alert, and strong for many hours. And this kind of feeling is called rush. So, they also like it because they feel sexy, and some like it because it takes away their appetite and they feel like they don't need to eat. So the average age of new methamphetamine users in 2016 was 23.3 years old, according to the U.S. Statistics Bureau. Also, in 2018, the monitoring the future stated that about 0.5% of the 8th, 10th, and 12th grade users in U.S. use meth. However, meth is not only used for recreation. Users like patients they can use it as a medication, which is used to treat attention deficit hyperactivity disorder or ADHD. And it works by changing the amounts of certain natural substances in the brain. It can help increase your ability to pay attention, stay focused on an activity, and control behavior problems. And it may also help you to organize your tasks and improve your listening skills. Now we move on to methods of administration. So there are some ways that people do take methamphetamine, and some people smoke methamphetamine, and that's the most frequent route of administration. but it can also be taken as orally by injection or intranasal, or aka snorting. So people smoke it, and they smoke it through a pipe called flute. And so how they do it is that the drug appears in powder form, which is why they call it crystal form, and it can be processed into a rock, or another name is ice, or liquid form for the purpose of injection. So when they process it into as a rock, they smoke it by lighting it up into the pipe that's called flute. And so the smoking meth is believed to be the main cause of addiction because of the rush feeling or the flash feeling. If smoked or injected, the user experiences an intense sensation as called rush. And this lasts about a few minutes, but is described by the users as an extremely pleasurable feeling. If meth is taken orally or snorted, then the user experiences a euphoria, but not an intense high. Snorting produces effects within 3 to 5 minutes, and oral ingestion produces effects within 15 to 20 minutes. Many methamphetamine abusers use the drug in a pattern known as binge and crash. And this term means that the users take multiple hits in succession, and they're trying to do that so that they can maintain the high, and they maintain the high by taking more of the drug, high doses of drugs.
Methamphetamine causes the brain to release an increased amount of dopamine. As users become tolerant, they begin to take higher doses, take the drug more frequently, or develop a preference for more potent forms of the drug. This results in further impairment of dopamine receptor activity, causing perceptions of decreased happiness and pleasure, as well as permanent cognitive impairments. Methamphetamine dependence may be chronic or involve periods of binging with brief drug-free periods. Dependence is often associated with injection or smoking of the drug, and many studies show that dependence is related to the route of administration. This can be attributed to the rapid bioavailability associated with injection or smoking. Meth use in the short term can cause loss of appetite, significant weight loss, change in sleeping patterns, tremors or convulsions, hyperthermia, elevated blood pressure, rapid heart rate, and irregular heart rhythm. Long-term use of meth causes body sores from users picking at their own skin, outward signs of aging, and acne. The skin also takes on a dull color and loses elasticity, and teeth begin to decay and crack. It also causes breathing problems associated with smoke inhalation and irreversible damage to blood vessels throughout the body, including the heart and brain. Its use can also cause myocardial ischemia and infarction, and it also increases the risk of hemorrhagic and ischemic stroke. Deaths due to meth are caused by seizures, cardiac arrhythmia, and respiratory failure. Most people who take methamphetamine also take other drugs, which can have other effects on the body. When combined with alcohol, heart rate and blood pressure increase significantly higher than when using meth alone. Combining with opioids increases myocardial oxygen demand, as well as causes respiratory depression from opioids. When it is combined with cocaine, the vasoconstrictive and cardiotoxic effects from the drug are also increased. Meth also increases the risk of contracting blood-borne viruses through needle sharing and sexual behavior. The use of meth also brings negative psychological effects along with the desired ones, including severe mood swings, unpredictable and often violent behavior. Chronic users also experience psychotic symptoms including delusions, paranoia, and hallucinations, and the risk of developing these increases when the drug is injected. Depression and suicide rates, as well as anxiety rates among meth users, are much higher than the general population, with higher levels associated with longer use, more frequent use, dependence, and injecting the drug. Chronic use also increases aggressive behavior, which can accompany psychosis. Many cognitive functions are also affected due to the damages to several areas in the central nervous system. These include attention, judgment, and problem solving, memory, movement, and emotional control.
Withdrawal symptoms for large doses of meth could cause cravings and severe depression, constipation, diarrhea, headaches, red itchy eyes, joint pain, clammy skin, hyperventilation, irregular heartbeat, and shaking. Treatment for meth addicts. Comprehensive treatment is the best way to recover from crystal meth addiction. Most treatment includes an environment with supportive care, that is, receiving group therapy and therapies for cognitive behavioral modification. The treatment usually begins with detox, and the goal is to clear all signs of meth from the body. Cognitive behavioral therapy is also used to treat meth. It teaches addicts how to identify and correct problematic thoughts and behaviors that trigger drug use. It teaches abstinence and improving self-control. Contingency management is another form of treatment. In this approach, patients receive rewards or incentives in exchange for abstinence, and this abstinence is obviously confirmed through drug testing. The Matrix model is a 16-week outpatient treatment that integrates evidence-based behavioral therapies. This includes individual and family counseling, family education, and relapse prevention training. Naltrexone, a drug used to treat alcohol and opioid addiction, has also shown promise in treating meth addicts as well. A study showed that this drug significantly reduced meth cravings and the rewarding effects of the drug. Other medical trials are testing combinations of naltrexone and other drugs, including bupropion, which is used to treat depression and nicotine addicts.
And this concludes our presentation of methamphetamine. And these are references that you can use to look up other necessary information of this drug.